I want to start for the board with the latest indicator slide. I'm going to try and share my screen. So if I can get screen sharing permission, I will do that. So as the board can see in this slide, with the escalation of cases, this is the latest snapshot from part of our indicator dashboard. And then some bullet points for the board's consideration and information. So one of the things that happened over the last 2 weeks that led us to work very closely with the governor's office before the announcement last weekend, and the timing of that announcement, which was really important, was that hospitalizations very dramatically began increasing here in King County. We've had a 70% increase of hospitalizations over the past week. And for the first time since we had these indicators, we are seeing in today's data, for the first time, we are below the benchmark of 80% of 20% extra capacity, or that 80% benchmark we had for hospitalizations. So the hospitals around King County, as we've been working with all of them and they've been working with each other, reaffirmed this last weekend their agreement that they would work to make sure that no one hospital would go over their capacity, that they would work with each other, and that's already happening. We have a couple of hospitals that have larger COVID admissions than others, and we're facilitating that communication so that patients can get the care they need. Some of the hospitals are starting to limit elective surgeries, as they did back in the spring, in order to make sure there's capacity. So as part of this, in addition to the governor's announcement, we've been working to really put out information about the key to avoiding gatherings, because that's where we see the exposure occurring. And the governor put out information on holidays, about quarantining around those holidays. And actually, his statement for people to go get a negative test has driven, I'm going to talk about our testing sites here in a minute, but it's driven almost an overwhelming, in fact, the Seattle sites are beginning to get overwhelmed by people who not just are symptomatic, but are trying to get tested before they go visit people. And there's a caution. King 5 did a great spot just today to caution people about assuming that just because you get a test, it's safe to go visit your relatives. I want to point out that these indoor environments are so critical in terms of the ventilation. We're seeing more and more information that shows that ventilation is so critical in this pandemic. It's something that in the beginning we didn't understand that because we didn't see the whole science that's emerging out of this. We're encouraging people to wear masks even if they're staying 6 feet apart. That is another update that we are, I think that people had gotten used over the summer that if you were 6 feet apart from people and you were outside, you could take your mask off. And so indeed, in the indoors, that same sort of behavior, we've started seeing it in there. So we're trying to course correct that. We're still seeing disproportionate impact to the BIPOC communities. The largest percentage of cases of positivity rates is in the South County still, but really the outbreak is occurring all over. So I will stop my screen share and talk a little bit about testing. So one piece of good news for the board is that while we are having this meeting, we just put out our exciting news release that our next expansion of our testing capacity is happening at Highline College, and it will open Friday, November 20th. This new site complements our test sites already in operation in Renton, Auburn, Tukwila, Federal Way, and of course is in complement to all the Seattle sites that have been operating. The new site at Highline College will really focus on an area of the region where we know that we needed to do more testing and where there's a lot of the pandemic and a lot of exposure happening. It's done in partnership with CHI Franciscan. It's hosted by Highline College. It's just a fantastic example of people coming together during the pandemic. So that is just, I'm delighted that the board meeting was today, and we did that today. Just all fell together. But we are seeing extremely high demands as the pandemic keeps escalating right now, the demand for testing, and then the other folks who are concerned about travel, et cetera. So we're trying to message around that. Turning to contact tracing, as I've reported to the board over time, we have been ramping up our contact tracing, and for a number of weeks and months over the summer, we were actually handling our cases. We now have 75 staff working as contact tracers. We're bringing 10 more on, with 10 in the pipeline, and we're hiring another 10. Prior to the recent surge, 50% of all the cases were interviewed actually the same day. Since April, Public Health Seattle King County contact tracers have interviewed 13,282 people with COVID-19 to understand where they've been, how to help them, make sure people that have been exposed are then contacted, and that folks understand the need for isolation. So the primary goal of contact tracing is, of course, to decrease that transmission by identifying those people. But the other thing that's really important here is contact tracing actually gives us the opportunity to talk directly to the person to make sure that they can successfully isolate. And that if we ask them right away about, do they work in one of the critical high-risk environments like healthcare, in long-term care, are they working with a nonprofit that, for example, that works with individuals experiencing homelessness? In this way, we can begin to identify and then flag that and do further work there. It also allows us to knit together if there is an outbreak that's occurring within, say, a workplace, because we can then match if two people are working in the same business, then because of our work, we can flag that, and it helps us identify those outbreaks earlier than might not be unknown. So there's multiple strengths to contact tracing, and I'm just really sad to report that we know that contact tracing, when you have really high numbers, is not as effective because you can't keep up with it, and that's what's happening right now. 50% of our cases on referral are now having to be handled by the Department of Health. We are actually doing work to risk factor these so that when they come in, those areas that are that have the highest level of outbreak, we're prioritizing those areas and areas with higher poverty, that we will handle that. People where we know we need multiple languages, because that can be a struggle outside of King County for DOH to handle those. So we're prioritizing our contact tracers work while we're trying to ramp up and partner with the Department of Health. So we are continuing with this large outbreak to deal with increasing our capacity. But some of our cases are now being triaged to just receive a text message with how to isolate and get testing. And again, ask those critical questions about where they work. That's only about 15%. And it's from the folks that are in that group are from the highest areas of social economic status in the county. So with an assumption that they would have more resources. So with that, I feel like I'm always the ultimate Debbie Downer. We have a huge funding cliff that I've talked to the board about that worries me every day, keeps me up at night. The federal funding in supporting our COVID response ends on the 30th of this year. The restriction was built into the federal legislation. They're debating right now whether or not to extend that cutoff date, which would be a real blessing. But what we really need is new funding because, to tell you the truth, we've been burning through dollars with all of the public health efforts we have to do to the tune of about $10 million a month with all the support services, all the workplace investigations we have to do, all the help with food and other work. It is big. So I'm working with the county executive on bridge funding into the new year to see what we could do. The biggest uncertainty is when Congress will act and the next relief package will come in. Our congressional delegation has been super fantastic. Just any of you that want to give them a thank you for their countless efforts, and they're paying attention so much to what's going on. We've seen many false starts to this. But it is a really big worry because, of course, this virus just keeps going no matter what. I'll keep the board informed as to what we're doing. And what can the board do? You can continue to amplify our messaging. As the chair noted, we did a media blitz over the weekend. I was very privileged to work with huge numbers of nurses that stepped up to sign the article that we put into the Seattle Times. And for Thanksgiving, I think that any of you that have changed your plans, like me, I'm staying home with just my husband and I. We're foregoing seeing family. We're seeing family in a different way. I'm trying to model that by just telling people that. So if you are doing something that dramatic, I would share that with your voice. And the safest option is to avoid those gatherings with people that you don't live with and non-essential travel. I saw that CDC just recommend people cancel their Thanksgiving trips, which is a really tough message to be received right now. But clearly, it's all hands on deck. And I think we all need to remember this is not a permanent state. We are in a moment in time. I'm going to be very pleased to turn it over to Dr. Duchin to talk about the vaccines that are on the horizon. That's the good news with this. But we need to continue to support our community and help people as much as possible to stay the course while we know that this is so traumatic for families, so traumatic for folks who are isolated. Depression levels are up. All of that will be a long-term issues we will have to deal with as a country. But for right now, we need to make sure that we protect our families and protect our ability to respond to the virus. So with that, I'm hoping, Jeff, are you on the call? Can I punt it over to you?
He is not on yet, but is joining. So maybe we can do questions and then he'll hop on.
Okay, thank you, Susie. So can I answer a couple of questions while Jeff gets on?
Yeah, sure.
Board Member DeCastro.
Yeah, thanks, Director Hayes, for all the work you're doing, as well as the staff at the health department. Really appreciate the partnership with all the communities being affected. So my question is more around the contact tracing situation. I'm going to pause for a second.
Yeah, somebody needs to mute.
Thank you.
There you
So
go.
thinking beyond sort of individual level efforts with respect to contact tracing, and then also, with regard to your mention of BIPOC communities having the highest positive rates, I'm just wondering if there's any insights or findings from the contact tracing that has been done that can inform, for example, how and where transmissions are occurring at the community or population level. Are there any contextual factors that are kind of emerging, whether it's geography or gathering spaces like work sites or other places of business, for example? Because I guess what I'm really hoping for is there a possibility to direct public health interventions more intentionally and directly, and to those areas where contact tracing is potentially revealing where transmissions are occurring? So I don't know if that
Well, a couple of things to that. Thank you, Board Member DeCastro. These are important considerations. So a couple of things I'll start out, and Jeff's on, and I'm sure that he'll have thoughts on this. But remember early on in the slide, I used contact tracing becomes more difficult when the cases are so large for a number of reasons. Number one, what we're finding is when we interview people have had so many different potential exposure areas. So that's why it's so important to find out if there's commonalities of a workplace together or something. So actually the teams that we have formed for workplaces and all that do that prioritization. We're looking for those connections so that we can centralize efforts. So we have that priority risk area workplaces like healthcare, long-term care, and construction. We know construction has a problem. So we are working that, and when we are able to tamp down the outbreak again, the effectiveness of being able to zero into that, I would say, should improve. The one thing that we have done, because we've hired bilingual community health workers and contact tracers who are bilingual, we've hired navigators from the community, is that we're finding out more and more information just on the incredibly complex barriers that these communities are having. The individuals who in the way housing is done, the multifamily housing, and the difficulty to do something like isolate yourself in that, and families that don't want to use isolation and quarantine because they can't leave their family and they're worried about losing their job. So just getting those folks connected with people in their community to help just the stress of what they're dealing with, let alone having COVID in their family, is a real learning. And Dr. Duchin has spent time with our Pandemic Community Advisory Committee, really, and we had a whole wonderful presentation from the Latinx community just this week to try and further understand how do we get down that road. So, Jeff, I don't know if you heard the question or if you had anything else you wanted to add to this.
Yeah, thanks, Patty. Thanks, Board Member DeCastro, and hello, everyone. Sorry I'm late. I was with the CDC's COVID Vaccine Advisory Group, which, as you can imagine, is really active right now. So, yeah, this is the question I ask my team every day. So what can we be doing in the communities that are having high rates of positivity, high rates of transmission to bring that down? And the people who know best are on the ground community health workers who are working with these communities and community members themselves, as Patty alluded to, who I speak to periodically. And the feedback that we're getting is on a couple of things. One is, all the structural elements that are in place that health disparities in these communities exist even before COVID, still exist. So, larger multi-generational households in small homes makes, household transmission higher. Relatively, a higher proportion of essential workers, many of whom work in work environments that are challenging for transmission of spread of COVID-19. Also, there's challenges around, being able to comply with isolation and quarantine, as Patty mentioned. We try and support that to the extent possible, but there are sometimes challenges that are beyond our ability to address. And then there's also issues just around messaging, like everybody in the community is seeing. And one of the things that I learned last week from one of our Latinx business community members was that he told me in his community, there are lots of very large family gatherings happening without members from outside the household, but relatives, and that the community sort of interpreted household as any relative, not just people who live in the household. And they thought, well, it's okay because these people are my family. And, the message we've been trying to put out at every opportunity is, you can't tell if someone's infected by the way they look or feel, regardless of whether they're your friend or relative. If they don't live in your household, it's unsafe. But, getting these messages out is a real challenge. The other point is that there's just access to healthcare issues. We know that there's a longer time period between diagnosis and healthcare seeking, symptom onset and diagnosis in communities of color as well. Reluctance or inability with access issues to get tested quickly. So all these things are really concerning, and we're trying to do whatever we can to address them.
So Jeff, do you want to go ahead and talk a little bit about the vaccines, and then we'll have more time for questions?
Sure. Okay, so in a nutshell, there are 2 vaccines that have been in large-scale clinical trials with approximately 40,000 participants in each vaccine trial, that have recently announced, the companies have recently announced that their vaccines are approximately 95% effective. This is mind-blowing. Nobody expected that COVID vaccine to be 95% effective. Our very best vaccine is measles vaccine, and it's about 95% effective. So we were willing to accept a vaccine that was, 50% or even a little bit less, that cut your risk by half. Now, these data have not yet been evaluated by the independent scientific advisory boards that will have to evaluate them both at the FDA and at the CDC to actually, vet the data, make sure what the companies are saying is accurate. And, I think it probably is. They would be basically shooting themselves in the foot by announcing something that's not true and then have it be widely discredited a few weeks later. So I think their estimates are probably right, but there's a lot of detail we need to learn. For example, is it how effective are these vaccines in preventing severe disease, hospitalization, bad outcomes versus just infection? Do they prevent transmission or just, clinical symptoms and so on? And which age groups they might be effective in, although both companies are showing evidence of high effectiveness in adults 65 years and older, as well as younger adults, which is very excellent. And then, of course, the safety profile will need to be evaluated. The companies have expressed their intention to submit these data to the FDA by the end of the month, at least for Pfizer, and maybe shortly thereafter for Moderna. And then these vaccines, if everything pans out, they're safe, their safety data and their effectiveness data are good, as they claim, then they will be approved in one way or another, most likely, and recommendations for their use will be issued by the Advisory Committee on Immunization Practices of the CDC. Right now, the Advisory Committee is in the process of putting together a prioritization and allocation framework because we know that initially there will not be enough doses available to immunize the entire population. And the doses will come out in relatively small quantities at first and then increase over time. And we'll need to be able to get those vaccines, to people in an orderly way based on a framework that incorporates their risk of disease and ethics and transparency in who's getting offered vaccine at what time. So that's kind of what's in process now. And across the country, various states are working on draft vaccine implementation plans based on guidance from the CDC that will, when those recommendations are available, incorporate that guidance. Here in Washington State, the state is taking the lead for the vaccine implementation and working with local health jurisdictions on planning. And so our big challenge now is we've received no resources to do this work. And I've commented that the vaccine was developed at Operation Warp Speed, but the public health capacity to deliver this vaccine is proceeding at Operation Status Quo. And we are really, really hurting with the ability to do the type of advanced planning that we would like to do if we had the resources, that should be made available to prepare for the magnitude and scale of this operation, which is going to be something that is, larger than anything else we've ever done in public health or in emergency response in this country. So with that, I would be happy to take time to answer questions because I'm sure there's lots of questions about vaccine.
Board Member Honda.
Thank you. This isn't a question about the vaccine, but it's a question about South King County and why you think the rates are so high now in South King County and what we can do to try to reverse this.
Yeah, thank you for your question. I really don't have anything to add to what I described with my response to Board Member DeCastro's question.
Okay. Thank you.
Board Member Caldwell.
Thank you, Mr. Chair. And Patty and Jeff, thank you ever so much for all you're doing. You've just been phenomenal. As we all know, though, there's I think a lot of COVID fatigue setting in. And with the governor's new order for 4 additional weeks of closing down so many of the places that had been opening up or had opened up, I'm getting more and more contacts from constituents who had been very understanding up till now, but are now saying, hey, what about we're having to close down our business, or others are having to close down their small businesses, and that means people are unemployed and or they're struggling to keep things afloat, and perhaps the need is, and they're directing a lot of their frustration at the governor with the new order. And I can understand that. But for me, the health of everybody and really stopping this as soon as we can, the better. But what are your comments when you get asked that type of question?
Mm-hmm. Yeah, thank you. Board Member Caldwell, the measures that we've had to take against COVID are difficult and they are frustrating and tiring, and everyone is fatigued for good reason. Couple of things. This is a long-term challenge. When we stop taking precautions, when we relax precautions, the virus spreads very readily from person to person. And the amount of spread that we're seeing currently, because we were doing too many activities too unsafely, is very, very serious. The number of cases grows in proportion to the size of the outbreak. So we might have started at a relatively low level, and the rate of increase was relatively low, but as we get more and more cases, the rate of increase and the new cases that present every day and the associated hospitalizations and the deaths that will follow grows faster and faster and faster. And the risk we take not only is the risk of preventable COVID infections and the long-term consequences of those who survive, although most of us will do well, many people develop very serious complications that result in long-term health issues, at least as long as we've been observing at this point. But also a very large number of preventable hospitalizations and deaths, and we risk our healthcare system becoming completely overwhelmed and not being able to care not only for COVID patients, but for patients who need healthcare for other reasons, like heart attacks, strokes, cancer, accidents, and other things that they need to be seen for in the hospital. And mortality from those conditions can rise as well. So there's no controversy, around the world or within the U.S. about what needs to be done to stop the spread of COVID. We need to stop interacting as frequently as we're doing, and particularly we need to stop getting together indoors and where we don't wear masks. But every opportunity for transmission now is an opportunity for that virus to spread. So when people get together for non-essential activities, for social events, for things that are really not necessary, preventable transmission occurs, and that needs to be something that stops if we're going to protect our healthcare system, the health of our community, of our families, and of our loved ones. The thing that we need to do is to support the people who are being adversely impacted by the economic consequences, the unintended economic consequences of this horrible outbreak, and the measures we need to take to stop it. And our federal government needs to release emergency relief funding to the states that we can pass along to our businesses and to people who become unemployed. It's absolutely mind-boggling to me and unimaginable that the Congress is letting the communities across the country suffer like this because they're trying to do the right thing and protect the health of their loved ones in their communities. We have no choice but to protect our healthcare system.